Okay, we're recording. I'm literally watching my computer clock. We want to give everyone the chance to be here and not miss anything. Okay, it's 10. I am going to open the waiting room. So Tammy, just like literally count to about 10. Okay, here we go. Everyone's joining.
Good morning, everyone. Welcome to today's webinar. My name is Tammy Fredrickson, and I am with the JFK Partners Group at the University of Colorado School of Medicine. Today's topic is educational considerations for deaf and hard of hearing autistic children. Please feel free to type questions or comments in the chat box at any time. We do ask that you keep your microphone muted, just so that we don't hear background noise. We are recording today's event and will archive it to the JFK Partners website, along with other webinars in this series. We'll also post the handout for today, and you are welcome to print it or save it for future reference. Following the webinar, you will receive a link requesting an evaluation. You can request a certificate of attendance in that evaluation. All right, now that the business is taken care of, we can go to the fun stuff. Today's speaker is Dr. Deborah Mood. Dr. Mood is an assistant professor at the University of Colorado School of Medicine, Department of Developmental Pediatrics. She received her undergraduate degree in psychology from the University of Notre Dame. She attained an MA in developmental psychology and a PsyS in school psychology from Gallaudet University, and practiced for several years in a large urban school district serving DHH children. She did that before obtaining a PhD at the University of Northern Colorado. She completed a psychology internship at the University of Minnesota Medical School and a leadership and education in neurodevelopmental disabilities, or LEND, psychology postdoctoral fellowship at JFK Partners and the University of Colorado Anschutz. Dr. Mood works broadly with neurodiverse children and their families and specializes in working with children who are deaf and hard of hearing, including those with co-occurring developmental disabilities. Welcome, Dr. Mood.
Thank you, Tammy. It's so nice to be here today to talk about educational considerations for deaf autistic children. First of all, I have to give kudos to all of you for coming to talk about education during the summer. I know for some of our educators, you are off for the summer and you're still showing up today to join us, which I think really speaks to what we know about our educators in the field who are so deeply invested in the well-being of our children who are deaf and hard of hearing. And so I want to, before I begin, just make sure everybody has access to what they need in terms of captioning and access to the interpreters. If you are having difficulty with that, please put a comment in the chat, and Dr. Fredrickson is going to help me monitor the chat, and our team can help support you if you're having difficulty accessing either the interpreters or the captioning. All right. So I wanted to start with some disclosures today. The first disclosure that I have to make is that I'm a hearing neurotypical clinician researcher, and that I am a psychologist, not an educator myself. And so when I'm talking about educational considerations for deaf children with autism, I'm really coming at it from the perspective of a psychologist clinician reviewing the literature in education about supporting educational needs of deaf autistic children. I'm employed by the University of Colorado, and I have received NIH, NID, CD funding for a couple of different research studies. In terms of the objectives for today, we're here to talk about several different educational considerations, including summarizing how the symptoms of autism can impact language development of deaf and hard of hearing children. We're going to identify some educational strategies for supporting children in the classroom and think about some considerations for developing inclusive educational programming. I want to be clear that I'm not going to spend a lot of time talking today about what many of you have heard me talk about in the past in terms of, the challenges of differential diagnosis of autism among deaf and hard of hearing children. And I'm not going to delve very much into like, what is the diagnostic criteria for determining autism, and I'm coming to this presentation with some assumptions of having that understanding already. But if you're looking for that information, I've given that presentation previously. I think one of those is also probably even archived on the JFK website. So I'm happy to get you resources for that level of understanding if that's something that you came to the presentation today expecting. I want to talk a little bit about the terminology used in this presentation because it's really important. So I'm primarily adopting identity-centered terms for this presentation, such as deaf. And I'm using deaf as an inclusive term to represent all children, regardless of their hearing difference, all children who are deaf and hard of hearing, regardless of their hearing difference, when their communication and cultural preferences are not explicitly known to me or stated in the research that I'm citing. When referencing deaf children or adults who align with deaf culture and communicate using a sign language, you'll see some of that denoted in my slides with a capital D, as is the cultural norm. And I've also seen varied terms in the literature to reference deaf children who have developmental differences, including deaf plus, deaf with disabilities. You'll probably see me using both of these terms today. But I want to also note that when referencing the intersection of deaf and autistic, and there again, I'm using the identity-centered term, which reflects the preference of the autistic community. But when I'm referencing the intersectionality of deaf and autistic, it's really hard to know whether someone's identity is better captured by stating deaf autistic or autistic deaf. And there's a really great article that I've cited here by Alice Young, that really describes how families perceive this identity is really important to understand, because it influences where they feel comfortable seeking resources, what supports they perceive themselves to need the most, in part influenced by their own identity. And I think as educators, really having that in the back of your mind and your understanding of that is important. Another thing that is important to me to note before we start delving into the literature is that, the more I looked at this, it's really clear to me. I always think about what's missing in the literature. And it's very clear that the input of the deaf autistic community members is visibly absent from the literature and much needed, as is the input of individuals and families who represent other areas of intersectionality, like race or culture. And although seeking input from members of either the deaf community or the autistic community may be helpful, we have to recognize the unique experience of deaf autistic children and similarly seek understanding from members who share that same intersectionality. All right, so as we delve into the presentation today, I'm going to do my best to try to draw from evidence-based intervention, but to do that, if I'm really honest about it, in looking at the literature, what we're really talking about is evidence-based is a body of literature that typically has excluded deaf and hard of hearing children from a lot of the research regarding interventions for autism. And so when we're in that place, it makes it really complicated. And we know that when we're considering evidence-based practice, the best of the best that we consider the best of the best in terms of information to draw from is, randomized controlled trials that have been critically appraised and duplicated, and where we have multiple repetitions of that research by independent researchers, demonstrated in systematic reviews. And we're really not there. We're not there in this literature. We're nowhere near that. Where most of the literature that I'll be talking about is coming from is at the level at the bottom of this triangle of like expert opinion, a couple of single case study designs. And that's really all I could find in the literature. And so with that in mind, I think it's important for us all to consider when we're reviewing and looking for autism-informed interventions to support deaf and hard of hearing children. How do we think about that literature? We don't want to just throw the baby out with the bathwater because deaf children may not have been included in those studies, but instead we want to think about who's included, whether the intervention based on, clinical expertise would be appropriate for deaf and hard of hearing children, what modifications might be necessary to ensure the intervention is appropriate for deaf children. For example, I've had the personal experience of trying to modify evidence-based practices, like the Facing Your Fears curriculum, which is a curriculum for anxiety treatment for autistic individuals who have anxiety. And what I found is that, simply translating an intervention to ASL is often not sufficient for deaf children who may not have had enough adequate language access to understand the concepts, or when the metaphors used in those curriculums don't directly translate. And so then we often have to use our deaf interventionist brains to know how to modify that appropriately. I think in doing this, it's also really important to make sure that, community members are involved in the process to inform the intervention. And the essence of what I always talk about with intervention is we have to consider the why. What is the intervention intended to do? For what needs might it work? And when and for what situations may it not work? We don't always have that clearly, explicitly stated in the research that's available. But I have very often seen interventions kind of applied because they've been talked about as an intervention for autism without really thinking through, well, what skill is it trying to work on? What need is it trying to focus on? And is it appropriate for deaf children and what kind of modifications need to be made? So with that in mind, I'm just gonna briefly put up this slide. When I did a literature review, this is not a totally exhaustive literature review, but it is kind of capturing a summary of, several studies, the available literature that's out there in terms of what's available to us when working with deaf autistic children. And really the studies tend to cluster into two main groups. Those studies that are focused on like language type interventions. And you can see here on the left-hand column, there's one kind of review of what's out there, not just for the first study, the Banda and all study really references a review of anything that's out there for children with either blindness or who are deaf and hard of hearing. And then some of the other existing research studies really look at using communication systems like PECS, which will picture exchange communication system, PECS, P-E-C-S. Or the use of strategies like social stories to teach social language to deaf and hard of hearing children. In the other column, you can see that some of the other interventions or the literature that's described out there are really largely those case studies, those single subject designs, where they're looking at applications of different applied behavioral analysis, kind of ABA techniques for supporting behavioral needs of deaf children with autism. As I said, this isn't an entirely exhaustive list, but there aren't that many other studies out there that I could find. So with that in mind, my goal coming at this, recognizing that I'm not a teacher of the deaf, is to provide sort of a macro level view, a conceptual framework of thinking about these different areas of communication intervention and behavioral intervention. Okay, just giving a little time for the interpreter switch there. So here I wanted to show one of the things that I will highlight is what we know about the characteristic of language features of autism as they present in both sign and spoken language. So this is research from Dr. Aaron Shield, who studies deaf autistic children of deaf parents. So he found that there are many similarities in the language characteristics we see in deaf autistic children and hearing autistic children. So for example, in both signed and spoken languages, we see characteristics among autistic children that we don't frequently see beyond certain stages of development in other development. And so some of those similarities are like persistent use of jargon in sign and spoken language. So in spoken language, that looks like use of sound or speech combinations that don't necessarily approximate a recognizable word in the child's native language. In sign language, that can look like persistent manual babbling that doesn't serve the same communication function as early manual babbling in development of ASL. You'll also see repetition of what's signed or spoken, which we call echolalia, which is not part of typical development past the age where children are using spontaneous spoken or signed phrases outside of children with autism. In spoken language, we see pronoun reversal, like confusing you and I. But in sign language, where like the pronoun reversal of you and I would be switching the point in sign language, which we don't really see in clinical samples. But instead, what Dr. Shields saw was a pronoun avoidance. So rather than using a point to which is similar to a pronoun in ASL, not exactly. I know the linguist will say something to me about that. It's not exactly the same, but children will avoid like using a pronoun. So for example, they might reference someone by a characteristic or their name rather than pointing to them and establishing them in space. We'll also see in both sign and spoken language idiosyncratic language, which is kind of using language that has been essentially cut and paste from elsewhere into conversation, and difficulties with several of the aspects of pragmatics in social communication. Some of the features that are unique to how autism can present in sign languages, like I said, are that pronoun avoidance rather than pronoun confusion. And Dr. Shield also found that deaf autistic children of deaf parents were more likely to have palm reversals. So reversing the palm orientation which his literature kind of suggests might reflect a self-other mapping difference in autistic deaf children. I'd refer anybody, these are really fascinating studies that we don't have time to go into in detail, but I would refer anyone who's interested in this to look up his work. And we'll also see differences in, we know that ASL uses a lot of facial grammar. That's really important to contribute to meaning in ASL. And we'll see that deaf autistic children, when compared to typically developing deaf children, tend to have differences in their understanding and use of that facial grammar, or those non-manual markers especially, but still perform better than hearing children. And that's some of Tanya Denmark's work. And then we also see difficulties within ASL, some of the grammatical features of setting up people in space, referencing others in space. And so we can see how the impact of autism has a specific impact on acquisition of language for deaf and hard of hearing children, as well as for hearing children. So one thing that I really want to highlight is that Dr. Shields' research really tells us that even for deaf children in ideal communication environments for accessing visual language, so those with deaf parents, when they have autism, they may still have a language delay. So in his study, about a third of his sample had minimally expressive sign language. And on average, receptive ASL skills were significantly delayed compared to their matched deaf peers. So this kind of suggests to me that exposure to sign in and of itself is unlikely to be a silver bullet in the case of autism, even though we sometimes see ASL being used as an intervention for hearing children with autism. What I often tell families is that deafness-related interventions often focus on improving access to language through visual communication and or hearing technology, as well as those environmental modifications to make language more accessible and bring language closer to the child. And so the assumption is that if the child has access to language and those modifications have been made appropriately, and the child is bathed in language that is accessible, that they'll develop those language skills spontaneously. So that's an assumption of typical development for deaf children. But research such as Dr. Shields really highlights that the brain-based process of acquiring language is impacted in unique ways by autism, in ways that we're honestly still trying to understand. And what I see clinically is that just because accessible language is happening, which we can't always assume it is, but even when it is happening around autistic children who are deaf, it doesn't always mean that the child is keyed into that language. They may not be attuned to their social environment yet because of the symptoms of autism, especially at earlier developmental ages. And so we may first need to simultaneously build in interventions that help the child key into their language intervention and recognize the power of language and communication with other people in order to foster that language growth and development. We'll be talking about this a little bit more throughout the presentation, but there are aspects of autism or that are commonly associated with autism, such as motor planning difficulties, apraxia, difficulty with that perspective taking, that may have a unique impact on the acquisition of language, as Dr. Shields' work shows. And we also know that the path to symbolic understanding, which is necessary for language development, can be impacted by autism. So if we want to help deaf children establish functional and fluent expressive communication skills, we need to provide access sometimes in different ways, such as through the use of AAC or object-based communication systems initially. And we'll talk more about that in a minute. I want to be clear that I'm not suggesting that one of these is more important than the other. We need to have both accessible language and autism-specific interventions, and the research does give us evidence for that. So when we look at the research of children with cochlear implants who have autism, most studies indicate that children with autism and other developmental disabilities are less likely to be wearing their cochlear implants consistently. Unfortunately, many of those studies don't clarify whether children had access to visual communication like ASL. It does show that deaf children with autism are more likely not to have functional communication than their matched peers who have autism. So we might expect 20 to 30% of hearing autistic children to be considered what the field of autism refers to as minimally verbal. But the risk for that is substantially increased among deaf autistic children. Some of that literature was suggesting that deaf autistic children might be as much of 50%, depending on the sample, may have minimal functional communication. So it seems reasonable to hypothesize that part of the reason for that, disparity between the functional communication of hearing autistic children and deaf autistic children is that reduced access to language. So making sure that they have access to visual communication and communication through hearing technology and using autism-informed strategies to support their hearing device use are reasonable interventions to ensure that deaf autistic children at least have comparable outcomes to autistic children with typical hearing. So I want to shift to thinking about communication considerations. This slide kind of, I borrowed some of these concepts from this article by Bruce and Borders, and they didn't talk about traditional approaches being just child-centered, and I don't think that all of them are just child-centered, but for the sake of making a point, I think a lot of traditional interventions have been primarily child-centered. But when we're really thinking about communication with children with complex needs, we need to be very strategic about not placing an emphasis just on child-based intervention or interventions targeting the child, but also thinking through interventions targeting partners for communication and the environment. And making sure that we're not placing emphasis on a singular method of receiving or expressing communication, but giving complete access through a variety of means of communication because of the developmental unique needs of deaf autistic children. I'm going to talk about that in more detail, but before delving into each of these areas of intervention focus and some of the strategies that fall under each, I think it's important to recognize that one of the things for me that makes navigating intervention complex is that, sometimes I feel like I am pulling from oh, the lights went out in my office. Sorry about that. One of the things that tends to happen to me is sometimes I feel like I'm pulling interventions from my autism bag of tricks, and sometimes I feel like I'm pulling interventions from my deafness bag of tricks. Sometimes those interventions are essentially the same, and then there are other times where they seem like they're not compatible. And for me, when I take a step back and I think about why that might be, I think it's important to recognize that there are different theories about language acquisition that contribute to that. And it's not always readily apparent to us, like what theory a particular intervention is drawing from. But generally, the theories driving language acquisition are driven by either developmental models or behavioral models or social interactive theories. And certainly there are areas, as you can see by this Venn diagram, where interventions draw from more than one theoretical orientation. But sometimes I find that I struggle to reconcile these approaches, and if one isn't working, then I have to take a step back and think about, like, okay, well, what approach was I coming at this from, and do I need to shift to incorporate some of these other theories? So for example, my training and my orientation is heavily developmental. And many of the autism approaches that I've been trained in integrate all of the three above to some degree. But if I'm looking at something like communication systems for children, I'm inclined to think first developmentally, which assumes that there's a natural progression between movement from like object-based understanding to symbolic understanding, and that communication follows the same course. And so that leads me to think that sometimes I get frustrated when I see people using picture-based communication when I've assisted child and they really aren't at the level of understanding that pictures represent things. So I would be inclined to, from a developmental perspective, recommend an object-based communication system. But I know that there are colleagues who follow more of the behavioral approach, who challenge this at times and think that, and maybe appropriately so, stating that those picture-based strategies can be taught through a systematic approach of reinforcement. And so, we don't always really know which approach works best for who. And I suspect that which approach works best depends sometimes both on the child's needs and the ultimate goal that you're trying to accomplish. And neither may be wrong. But when they aren't a good fit, when we're not seeing progress, it might be that when the theory and the approach aren't well aligned with the overall goal. So for example, if I'm thinking about just getting some functional communication established, some of those behavioral approaches that establish that functional communication through a lot of systematic explicit teaching and reinforcement are totally appropriate. But if I'm thinking broadly about spontaneous communication across a variety of approaches, we have to think sometimes more broadly about some of the social interactional and developmental lenses there. They can be done also through behavioral approaches in a systematic way that takes into consideration making sure that those skills are generalized across situations, environments, and communication partners. But the point of all of this long-winded explanation is I think we just need to make sure that we're collecting data, that we're thinking, and we are coming at this with an understanding of why we're doing what we're doing, and that based on the data that we're collecting, that we're adjusting intervention, not just after like months or years, like our IEP and IFSP processes kind of suggest, but within weeks. So that if something isn't working to meet a particular communication goal, that we're collecting the data and making those changes. And I fully understand how complex that is, and how time intensive that is, and the level of support that's needed. And I think we have to think about that for everybody on this presentation who's involved in an administrative role, to be able to make sure that we're providing the supports to really do this intervention appropriately. We'll see that many of the autism interventions cover multiple theories, like the use of PECs, for example, draws heavily from behaviorism, but also emphasizes communication with partners. Interventions like Early Start Denver model draw upon developmental, behavioral, and social theory. So like I said, there's lots of places where these theories align, but it's just important to know where we're coming from in selecting an appropriate intervention. So again, thinking through in terms of child-focused interventions that are focused on the child. There are many, I think we need to first do assessments to determine the child's language access. So here I want to pause a little bit, because how I think about determining a child's language access is quite complex. And I'd love to hear from the audience in the chat how you all think through what information you need to gather in order to determine the child's, whether the child is, what they need for accessing language, and what sources you use to gather that data from. So real quickly, if y'all could put in the chart what kinds of things you take into consideration when determining the child's language access. What sources are you using? What resources do you use? And Tammy, I think, is going to help me summarize a little bit some of the comments, which are hard for me to see when I'm screen sharing. Is anybody out there, Tammy?
I don't see anything in the chat yet. Don't worry, there are no wrong answers. That's the good news.
Yes.
So
Yeah.
we're all here to learn. So yes, so thank you. Lindsay commented child's observable interest in others' social behaviors.
Mm-hmm.
Sarah noted, does home language differ from school community language? For example, English versus Spanish versus sign? That was
Absolutely.
mine for me too. Jesse says hearing technology and if it's programmed appropriately, if applicable.
Definitely.
A comment, informal observation. There's so much we can learn from informal observation.
Mm-hmm.
So who, just kind of follow-up question. I know one of the questions Debbie was asking is, who do you talk to? What are your sources? Lindsay indicated who else lives in the home? How do they communicate with each other and with the child?
Mm-hmm. Thanks for being brave and jumping in. As Tammy said, there's no right or wrong answer here. I genuinely want to hear from the audience how they think through this, because it is a challenge. It is a challenge. And I think sometimes we're kind of making assumptions about access based on observable behaviors from the child. And sometimes that can be complicated for children with developmental differences.
And I'm just going to jump in. Someone mentioned about deaf language models, if that's appropriate, the classroom teacher.
Absolutely. If that's accessible, right. If they're, and here I'm thinking, like, what do they need to clarify? What do they need for language to be accessible? So there's a whole variety of different ways you can think about this. I find Matt Hall's research about language access profiles and some of his tools, which are really more research tools at this stage, but that way of thinking about language access really helpful. And on our teams, we're complex. we overthink this, I think. Well, not overthink, we think about it complexly. And so we gather all kinds of information in a clinical setting about, the child's degree and type of hearing difference, but how we want to know what the etiology of their hearing difference is, because sometimes that has an impact on what I might expect them to be able to access. I want to know whether there are other medical factors or developmental factors that contribute, like the presence of seizures. I want to know if they have access to visual communication in the home and school environment. Sometimes we look at LENA records to look at what that language environment looks like in different settings. We might want to know whether they're able to use from their audiologist. I know there are audiologists on here. We want to know whether they're effectively using their hearing technology to access language, not just for sound detection, but all the way up to the level of comprehension And if we don't have data that suggests that, we need to make sure that they have means, I mean, we always need to make sure that they have means of accessing communication, but especially if we don't have evidence that they're able to do that with their hearing technology, we need to make sure that there's visually accessible language for them. And so, you know, partnering with your child, with the child's parents, with like community members, with audiologists, with speech language therapists, and other interventionists to gather all that information to really think through how they're accessing language. And then, so that's just like what we think based on our best understanding of that data tells us what we think they need to access language, or how effectively they're accessing language, maybe more appropriately stated. And then we also want to do some assessments of like what their actual understanding of language and use of language is. And again, for deaf children who are not yet using formal spoken words or signs, sometimes we have to draw from different tools to do that. We want to do those observations of what we see them doing in the environment. Sometimes we use tools like the communication and symbolic behavior scales or the communication matrix, which is really helpful to me to understand whether children are still at that kind of concrete level of understanding, or if they've broached into the level of symbolic understanding and symbolic language use, whether they're communicating through behavior or through symbolic means. And so I think that's really important also. And then also, like, for more formal language tools, you know, this is where pulling in a speech language therapist or a language therapist is appropriate. I know many of us feel like it's really challenging to appropriately and adequately assess ASL, because there simply are less standardized tools available for that. But Gallaudet's VL2 website lists some ASL receptive and expressive language tools that are available. And that's listed on the resource page of this presentation, so you'll have that. But what I see clinically is a lot of teams developing communication plans. Here in Colorado, that's required for deaf children to have a communication plan. And often that's based on the latter, just an assessment of what the child is understanding and using without first considering the former, how they are accessing language. And we have to be very careful, especially for deaf children with disabilities that impact the acquisition of language, that we're not assuming that just because they are not expressively using a particular type of communication doesn't mean that they don't need it for access. So here I'm specifically referencing autistic deaf children who have reduced functional communication, who are placed in classrooms without access to sign language, even when we have evidence that they are not reliably accessing spoken language at a level sufficient for comprehension, even with use of their hearing technology. That's like a really complex statement to like unwrap, but I've seen many children who have really significant developmental needs placed in classrooms without those DHH kind of supports really well integrated, including access to sign language. And I've even heard school teams kind of referencing a child who has autism, who's communicating at the single sign level, as using baby signs. Even though if we think about it from a developmentally informed lens, what they're really doing is acquiring language at a which their language might happen to be ASL at a slower rate of language. So I'd encourage teams to take a deeper look and ask questions like, what cues are in the child's environment that they're drawing from to understand? What information do they consistently, not just occasionally, respond to directly? If they can only respond to it within the context of visual routines, like consistent routines, that suggests to me they may not fully understand or have true access. I want to look at whether they're responding to tactile cues or symbols or objects or signs or spoken language, and at what level, the single or phrase or fluent language level. What cues, I also want to look at their communication environment and really take a careful look at what cues are provided to them consistently in a manner that's accessible to them. And does the child have the developmental skills, like cognitively with their attention and focus, to be able to shift and divide their attention between like an interpreter and the teacher, for example? Or do they require direct communication that's scaffolded to their language level? And in this regard, I think, you know, there's much that we can learn from, like intervener models for providing accessible communication that are used, for example, with children who are blind. When we talk about behavior later, I'm going to talk more about when assessing a child's problematic behaviors. We always have to take into consideration whether our potential antecedent to that event is related to reduced access to language. Another like clinical kind of thing that I see often that I want to point out is that can be challenging, I think, for school teams in determining an appropriate appropriate communication plan. Is that what I see clinically, especially at the younger ages where I'm most often seeing children, is that deaf autistic children are more likely, in my experience, to sometimes require a different means of accessing communication than the means by which they express themselves most reliably. Because of the nature of how autism impacts language acquisition, particularly in early stages of development. So, for example, I've seen this in deaf autistic children who receptively require ASL access or another sign system, but have difficulty expressing themselves in ASL at early developmental stages because of motor imitation or apraxia concerns. And therefore, they might require the use of like AAC to express augmentative and alternative communication to express themselves while developing those skills through OT and language therapy. But what I see sometimes is that school teams, when a child isn't acquiring that expressive language in ASL, they sometimes pull it receptively, assuming that the child isn't learning it but failing to take into consideration that the symptoms of autism might inhibit their ability to demonstrate what they're understanding expressively. I've also seen deaf autistic children who have adequate auditory access to fully developed like spoken language, but due to difficulties with apraxia have unclear spoken language, and therefore early in development use ASL or other AAC to communicate. And I've seen a deaf autistic teen who initially develops fluent spoken language, but then experienced like sudden progressive hearing loss that resulted in the need for ASL receptive language access and use of strategies like CART, that had marked difficulty learning to use ASL fluently at a level commensurate with their expressive spoken language, despite every effort to immerse in ASL environments. So the point, the takeaway point for this is that it's a highly individualized decision in thinking about communication, and that the individual's communication needs might change over time. And so their communication plan might needs to be revisited at least annually or sooner, in light of if there's like an acute precipitating event, like a change in hearing status. Okay, we're gonna move on. Okay. So this article that is referenced here is by Shield and some colleagues, Graham and Neild. And I thought it was a pretty useful article in that what they did was they identified areas of language difficulty that can be experienced by deaf autistic children, and then paired that with suggested interventions. And I don't know, I made an attempt to try to color code the ones that were more individual interventions because I was trying to have an organizing framework here of child-centered interventions. We'll talk about some of these, but really we won't have time to talk about them in depth. And so later on, I'm going to be giving you a resource that gives you access to training modules on things like video modeling, using power cards or social stories, which are ways of making explicit the sort of hidden social communication skills for deaf autistic children. So I'm going to be giving you that resource so you can look into those strategies more closely, but unfortunately we just don't have time to go into them in detail.
And Debbie, someone posted in the chat, does Colorado have their communication plan template posted online that we can reference if our district or state doesn't currently use or offer them?
That's a great question. I would look at the Colorado Department of Education website. It's been a minute since I've been on that myself. But that would be the first place that I would look to see that posted. But certainly if anyone else in the audience has a link to it or can easily pull that up, that would be helpful to that participant.
And I'm seeing someone did reply yes, so it must be out there somewhere. So
okay, great. Okay. So one of the strategies that the Shield article referenced is using AAC, and AAC refers to augmentative and alternative communication strategies. And AAC can be in unaided, so natural non-speech forms like gestures, and aided forms like use of an external support like object-based communication systems or picture-based communication systems, all the way up to higher tech options like speech generating devices. And again, the goal there is to provide easy access for expressive communication primarily. But it's important to recognize that AAC use is controversial within the deaf community, and that tends to occur when interventions are suggest using AAC even when a child has fluent ASL, which is perceived by the community as, prioritizing spoken language. If the device that they're using for AAC provides speech generating output over the child's already fluent use of another language, ASL. Another controversy is the use of AAC as a receptive language tool in place of and not in addition to access to a complete language system. And that, for example, like providing ASL language access. So I want to be clear that that's not how I'm referring to use of AAC in this context with children with developmental disabilities, where I'm talking about the value of AAC in meeting some of the developmental needs of the child to provide access to expressive language when either spoken language or sign language is not available to them. And also in a research study that we're running, that is not specific to autistic deaf children, but we're seeing some value of AAC as a language teaching tool in supporting executive functioning, and some of the nature of how AAC is set up as a visual static representation of language can be very helpful. All right, Picture Exchange Communication System, or PECS. Many people on this call might be familiar with that. I'm not going to go into detail about it again. Instead, I'll reference you to a webpage that I'll give you in a little bit that gives information about it. But it can be used to, and I think can be really helpful sometimes to help with that early stage of understanding how to communicate. and with getting the behavior of communicating with other communication partners going in a more concrete way for children who have difficulty making that gap, that leap to symbolic communication. And so PECs could be considered both a child-focused intervention as well as a partner-focused intervention. We could probably spend a whole day talking through all these things. I wish we had the time and space to do that. But I'm just introducing them as things to look into further. One thing that I think is important in talking through communication is really making sure that our interventions are supporting the child in developing all functions of communication. So on this slide, I've listed many of the pragmatic functions of communication, from greeting to protesting, requesting, commenting, giving information. We don't have to go all the way up to using humor. Deaf children have a right to humor, is how I often think about this. So we want to make sure that, and that involves a lot of complex language and a lot of complex language structures. So I want to make sure that, I would ask that you review IEP goals and make sure that the goals are covering all of these pragmatic features of communication. And then working with teams to think through, how do we support developing that? In terms of partner-focused interventions, there are many different strategies that we might think through in terms of making sure that partners are sensitive to the child's communication. So in deafness, we're used to early intervention really helping to support that in instructing caregivers on recognizing the child's communication and being sensitive to it. It may be that needs to be tweaked a little bit to recognize the unique ways that autistic children may be communicating. A lot of times it involves instruction in the child's most accessible means of communication, if that's not their communication partner's first language. So in a school environment, I want to think through, if I think through the child's schedule, who are the individuals that they're interacting with, from not just the teacher and their peers, but everybody in that building, and who needs to be instructed, who interacts with that child, to be able to provide accessible communication in a way that's meaningful to the child. That seems like, when you have like those early trainings before the start of the school year, that might be a good time to kind of, before the children arrive, to kind of think through that and reach out to those people and provide some of that training. Some of the other strategies that we talk about relate to like augmenting the input and training partners to be able to augment input for children using spoken language, acoustic highlighting, for children using sign language, through changing the pace of signing, increasing tactile cues, which is not, as a hearing person, that's not, and especially like in a school environment, that sometimes feels like a lot to think through how to do that in a way that feels safe and comfortable and natural to everybody. But when we consider that sometimes is the most accessible means of communication for a lot of our deaf children with disabilities, this is something to really think through carefully with school teams. Sometimes that's signing from the child's perspective, because we know from Dr. Shields' work that signing and having to flip that perspective can be difficult for deaf autistic children. So signing next to the child as opposed to across from them when they're having difficulty producing the sign might be important. Using objects, PECs, and AAC, and training partners how to use them is helpful. And I've put up on my slide right now, it's tiny, but maybe that's because my vision is going, but training in how to support a child's hearing technology is important. And I would argue that making sure that there is always beyond just the teacher, but always at least one other adult in the building who knows how to recognize when a child's hearing technology is not working and what to do about it. Again, a great place for like some of that training to happen before the start of the school year to get those supports in place. And then in terms of training partners about using AAC, I put up a link to some really nice video modules that one of our AAC therapists here, Carolyn Weber, developed that are fabulous. I think I'm probably like, I'm going to go through, oh, I think because the chat just popped up on my screen, now my screen is frozen. Okay, let's see. Okay. All right. So here, here's an example. Like one of the things that I really loved about my training, so I always bring it into a lot of things that I talk about, are the concept of like routines-based interviewing. And that comes often from, is a predominant tool that we use in early intervention. But I think that a lot of this can feel really overwhelming. But if we can like organize it in a way that helps us really see how we can work on these different goals within the routine of a school day, and who's the person who might be involved in that, and then how are we going to collect the data, I think it's like just a helpful organizational framework. So here's an example of how I might take communication goals, identify partner roles, and develop an explicit schedule for how to focus on those and who will be involved. And, I've seen similar concepts applied in autism intervention. And one of the reasons, and I think if you haven't seen it, Snell, SNELL, has a number of really great materials related to how to kind of build these types of ecological assessments and intervention models. But what I like about this from the autism perspective is that we know that children with autism require intervention that's of sufficient intensity and frequency to promote learning. So they require multiple learning opportunities throughout the day, and they sometimes have difficulty generalizing skills to the natural environment. So this embeds training in the natural environment. And you can see like within this routine, like readings are, talked about more than, several times. Responding to peers or initiating with peers. There's several different times during the day, and I can only fit 4 examples on this slide, but you can think about through the day how that same skill can be embedded across activities. I think it's, obviously this is a model based on a preschool type setting, but the concept can be broadly applied. So I've seen, similar charts for where the teachers map this out with goals and objectives, like kind of embedded within this kind of structure. All right. Environment-focused intervention for supporting communication can include a variety of things, many of which I think are familiar to those who are coming at this from a deafness training background, like reducing visual clutter or obstructions to communication. Like there's often things like hanging from the ceiling or on people's desks that get in the way of visual communication. We're also, in deaf intervention used to thinking about those setup of the classroom, like, those things where they say, tell me it's a deaf classroom without telling me it's a deaf classroom. And you see a picture of like all the chairs set up in a U, right? Because that's a way of making it clear to the deaf child in the classroom. Like they can clearly see everybody in the classroom to know where communication is happening. Or, using other strategies and adopting other strategies within the classroom, like an expectation of hand raising or signaling otherwise before speaking so that the deaf child can orient to the speaker. Another thing to think about is the use of technology. Like, is the classroom teacher trained in that? Are they using those strategies? And another one is adding items that really support understanding and the ability to communicate. So having picture-based communications or object-based communication systems. Another thing that I see as being really helpful is having duplicate items. So for example, and this is coming from an autism kind of informed lens, that, you know, sometimes a child's ability to shift between what is happening up in front of the classroom and what's happening in front of them isn't great. But if they can have a duplicate item, that might help that. Or similarly, if there's an ASL interpreter or a teacher communicating about something, sometimes just having a concrete model right in front of the child is helpful to them. And sometimes they honestly don't like having their preferred materials removed. And so in that regard, it can be helpful as well. Okay, I don't know where I am on time, but we're going to talk through some behavioral considerations. And I just want to highlight that here I'm going to take a similar type of approach, talking about, you know, we need to be focusing our behavioral interventions not just on the child, but also on their partners and the environment, and that we need to be taking theory-driven approaches. This is Christy Borders has some really nice educational materials that she's written related to intervention for deaf autistic children. And in this study she did, and you'll see the reference to it on the bottom of the next slide, but she talks about teachers she surveyed teachers of the deaf, and she found that 55% of them, so just over half, had expertise beyond working with deaf and hard of hearing children, but 45% reported that their training really focused specifically on deaf and hard of hearing children. So teachers of the deaf, depending on their training program, may or may not have special education instruction in autism, for example. And so the teachers that she surveyed had varying levels of awareness of established treatments for autism. From anywhere from 20 to 100% of the ones she surveyed were known by the participants. I think this, in my mind, really speaks to the need for us to establish supports for teachers working with deaf autistic children. We really need to build, and I'd love to hear thoughts maybe as we get to a little bit later on, about how to establish that community of practice, because we know a recipe for burnout is not having the skills or resources to do your job. And how many of you would appreciate an opportunity to connect with others who work with deaf autistic children to share resources or problem solve and how to apply these evidence-based practice for children who are not typically included in that research? So I'd love to, if we have time, maybe have a little bit of a discussion about that. I think also one of the things that contributes is that among the teachers of deaf who were surveyed, they had varying opinions on the effectiveness of these autism-based interventions. And I don't know where that comes from. I don't know whether that's because the right strategy wasn't applied, or it isn't effective with deaf children, or it wasn't modified sufficiently for deaf children, or if it just isn't effective. We don't really know. So again, I think having that community of practice to share resources would be helpful. I think it's also important to recognize that just because teachers are familiar with it doesn't necessarily mean that they're implementing those strategies. So what supports are necessary, from an administration standpoint, to make sure that teachers have the supports to be using those practices. And I know many of these are time intensive and resource intensive. And that's something that all teachers are short on. And so from an administration perspective, like, how do we provide enough support staff, enough time, enough teaming to really be able to provide appropriate interventions? I promised you all this resource. This is a great place to go to. These are great places to go to, especially those affirm modules listed here at the bottom, for learning more and delving deeper into interventions that have been determined to be evidence-based autism treatments. Again, it still requires us to use our understanding of deaf children and what they need to determine whether it's an appropriate strategy and how to modify it. I'm sharing this slide because I don't know, I like to share the things that had an impact on me. And this, how I was trained in this really came from the early start Denver model, but Project Impact is another place that kind of similarly conceptualizes this idea. Project Impact is a parent training program that's evidence-based for treatment of autism. And it really trains, this is a partner-based intervention, right? Where it trains caregivers to be able to be responsive to their autistic child's needs. And I think some of these same principles apply to the classroom. So what this diagram is trying to show is that when the child is regulated, that's the time that we can teach new skills. But if they're not well regulated, then we need to do some things like focusing on them, helping them to get regulated, adjusting our communication. And once they get into that regulated state, creating opportunities for learning. And if they stay regulated, teaching those new skills. And one of the things that I learned in learning ESDM was that as I was working with autistic children and deaf autistic children to try to implement those intervention strategies, I would, it could change from within the session of what I was working on to across sessions where, one day a session would go great using particular strategies. And then the next day I'd be like, wait, none of this seems to be working. So I had to learn to be flexible and really thinking through, okay, where are they? Is this the time to be doing this? Do I need to take a step back and pull from some of these other strategies to get them regulated? So I think that the idea is important to think through. I know that can be challenging in a classroom, and again, might require some strategic teaming when you have the needs of multiple children in your classroom. To be able to flex adaptively to focus on the child sometimes is challenging. But how do we build those, using this model within the systems that we have? How can we apply some of that to make it more likely that we're going to spend more time in a state where the child is regulated to be teaching new skills? The other biggest takeaway, this is not related to this slide, but I wanted to mention that I learned from early intervention from an autism standpoint is that because of the scattered skills that we can sometimes see where there might be skill gaps for autistic children developmentally, when I was trying to work on a particular new skill like developing language, every other developmental aspect of that task needed to be much easier than what I even thought it might need to be. So if a child is working on language, I need to select materials that are not too advanced for them in terms of that don't have a high motor or cognitive demand. And I know that this principle may be something that every early interventionist in particular already knows, but for me, because I just found that I was continually reframing what that looked like. And sometimes if I just changed the developmental aspects of some of the other components of what we were working on, I could see their ability to work on the focused skill really emerge. I know I'm talking about this in terms of early intervention, but I think it still applies for middle schoolers and high schoolers. So if I'm asking a child to write an essay, knowing that writing involves language, cognitive components of generating ideas, fine motor skills, executive functioning skills, the demands of organizing all of that, I might try to, first remove some of the motor demands or the executive functioning demands by maybe I allow them to sign or dictate the story first, or maybe I remove some of the executive functioning demands by using graphic organizers. So the concept is still there that we want to, if you're really be mindful of what is the skill that we're trying to teach, and then make sure that we try to remove some of those barriers of the other developmental demands to make it easier to teach that skill. In terms of environmental structures, places like Teach and their model do this really, really well. So the Teach model, it's something to look into, really emphasizes having a lot of environmental structures in place, like having those visual checklists, visual schedules, object-based schedules, you'll see here lots of different examples of making things visually apparent to make the task expectation more clear. And I'd encourage you all to look at some of those. I know many of you are probably familiar with them. I'm not sure where we are on time, but I'm expecting that we're probably low on time. And so what I'm going to do is, as we start to think about child-centered intervention, I think it's helpful to think about what we know about the neurocognitive strengths and needs of autistic individuals to help with thinking about areas to target for intervention. So we know that there can be gaps in terms of and a range of cognitive abilities for autistic children. We need to make sure that we're providing instruction at their developmental level. We see many autistic children who might be hyperlexic, but might have poor reading comprehension. So being aware of what those needs might be and supporting them in the classroom is important. We often also, I skipped way over that, didn't I? We also find that oftentimes the adaptive skills of children with autism lag behind their cognitive skills. And so we might need to support that. And occupational therapy can be helpful with that, as well as like some of the other tools and strategies that we've talked about. We've talked a little bit about how, I keep jumping through slides, how motor skills, like difficulties with low tone or motor coordination or apraxia or dyspraxia can impact autistic children. And we know that balance concerns have been reported at higher rates for deaf children in general. And so both of those things need to be addressed through physical therapy or occupational therapy. They might need support in play skills, handwriting. All of these things need to be attended to by, unfortunately, in educational settings, we have really nicely integrated support specialists in those areas.
Dr. Mood, you have about 15 minutes.
Okay, great. I have no concept of time. I told them at the start of this presentation that this is like a bad Vegas. There's no lights, no like external lights, and I have no clocks in my office. So thank you for the time reminder. So in terms of executive functioning skills, also, it's important to think that this is an area that can sometimes be impacted for children with autism. And so the executive functioning skills I'm talking about really direct an individual's thoughts, actions involved in problem solving, such as initiating and planning. So sometimes they might have difficulty with flexible use of language or following through with multi-step routines. So we need supports in those areas. And I think it's also, this comes from Unstuck and Untarget. It's also important to think about the difference between won't versus can't. A lot of time what looks like won't, and this is a table from, again, from Unstuck and Untarget, that really talks about how those executive functioning difficulties can make it look like the child is being oppositional or doesn't want to do something, but really it might reflect difficulty with getting started. And so some of those executive functioning resources like Unstuck and Untarget are great to be great resources for educators to think through how to problem solve and intervene for those areas of difficulty. I think we also have to, especially when thinking about behavior, have to be attuned to sensory processing differences that can really impact children's ability to tune in, be comfortable in their environment, and be responsive in their environment. And so we want to be proactive about addressing those sensory concerns. And here's a place where like occupational therapists can be really supportive in being proactive in addressing those concerns as opposed to reactive. And sometimes when we're reactive to those behaviors, sometimes we inadvertently reinforce negative behavior. So consulting with your school-based occupational therapist is really helpful. I'm going to speed through some of these. These are just some visual supports that, are kind of individual interventions that really, things like first then strategies are really helpful in teaching children who have difficulty with transitions what to expect. So one thing that I want to comment on, and this is kind of a terrible visual, it's so bright, but you'll often see people use these kind of first then boards and put a picture of, you know, first work, then some play item or some preferred item. And they can be really, really effective. And so can things like visual timers when they're used proactively. But first then strategies are also, from a developmental lens, important to teach developmentally. It's not something, especially for children who don't have the language access to understand the concept of first then, it's not something intuitive. And so we might need to teach first this preferred activity and then this preferred activity before we shift to teaching first this slightly less preferred activity to then this preferred activity for that particular intervention to be effective. So sometimes when I see people saying that it's not working, it's because it hasn't been taught kind of explicitly. Most of the literature out there really talks about behavioral intervention approaches like ABA. And ABA in the autistic community is not always thought of positively. And so I think it's important, again, to think about why that might be and to solicit feedback from the community. Sometimes that's because in the community, concerns are that ABA therapy is trying to make neurodivergent individuals typical. So, you know, instead of recognizing what is essential and important about who they are as individuals, trying to make them uniformly neurotypical. And there are other concerns about ABA that we could talk about again at length that really are critical to be thinking through complexly as a community and to be soliciting that feedback from the community. So that first needs to be addressed. But there are, I think, still a potential place for ABA-informed strategies, like systematically thinking through how are we going to break this task down in order to teach it after we've first made sure that the task really is essential for the deaf autistic child in meeting their own personal goals to contribute to their quality of life. We don't have that much time to go into ABA, but a lot of the modules that resource that I provided you earlier give you information about that. And then I've provided these next slides, which is an application of a model based on both relational types of interventions and behavioral interventions called classroom-based pivotal response therapy, which is at a classroom-wide level applying some of the strategies of ABA. And what I've done here is listed what the strategy is from this model and provided some guidelines for self-assessment about, or, you know, maybe in observing other classrooms about, are these things happening in the classroom? Like, have I provided choices? Am I making instruction relevant and capturing the student's interest before beginning? Am I selecting preferred materials? Am I making sure that there's some turn taking happening? Am I providing, you know, am I gaining their attention before providing instruction? Am I using clear cues? Am I varying those cues to match the child's communication needs for understanding? And how am I rewarding behavior? Am I doing that through a variety of different mechanisms? Is it direct? Is it frequent enough? Is it contingent on the child's behavior? Those are all kind of like self-guided assessments. I want to provide. Yep.
Sorry, we have about 7 minutes left.
I have 2 more slides and then questions. Okay. So I want to talk about, in Colorado, there's legislation that was passed, House Bill 22-1260, which describes ABA as falling under potentially a medically necessary service. which enables it to be provided in schools under certain caveats and provisions that are, I encourage you to go to this document to look at it, and also to go to your child's school district to look at how they're interpreting and guiding the implementation of this bill within your child's school district. But I want to suggest that in some situations, because it can be really difficult to find educational settings where both the child's needs for access and those DHH intervention supports are available, but they may not have the behavioral supports and understanding informed by autism available in that same setting. This might be a way to, I would encourage families to think about engaging in conversations with their school teams and their school districts about whether this is a way to kind of meet the idea of least restrictive environment in terms of the child's communication access, while also supporting their behavioral needs. So that's, again, another topic that we could talk about for a long time, but that I wanted to end with this very exciting day. It's my favorite day of the year. It's Deaf Autism Family Day. And this year it's going to be held on September 7th. It's at Happy Dog Ranch's new facility. So I'd encourage the educators out there to share this information with families of deaf autistic children. We'd love to see them at this day. It's a unique opportunity to find support, accessible support for both the child's communication needs and their developmental needs in one place. And so here's the QR code that is there for signing up. Okay, I sped through all that. I know we only have a few minutes left for questions, but I'm happy to take a few.
Thanks, Debbie. I wanted to comment, someone in the chat posted that they've worked with caregivers and regulation of caregivers for a long time. And it's saying that more shareable information and resources would be really helpful to support those new parents who are stressed and overwhelmed. And Dana, I'm calling you out because I love this, I'm just going to quote, calm is contagious. Right? And so I thought that was neat. Debbie, do you happen to know where there might be more information or resources for that sort of thing for folks?
I'm sorry, resources for
helping with regulation of caregivers, you know, these new parents who are stressed out and overwhelmed with all of the things, and recognizing this idea that calm is contagious.
Yes,
so
that's very true. I mean, we often say as mental health professionals that sometimes we think we're just like getting paid for people to come be in the presence of like a regulating setting, of course. But that's a great question. I don't off the top of my head have those resources, but I'm happy to try to track some of them down. I can think of I'm thinking of more like research-based articles, and I'm trying to think of more parent-guided articles. Does anybody in the audience have those kind of parent-friendly resources as opposed to research articles that might be more supportive? If you do, it'd be great, a great opportunity to share them here. The ones that are coming to my mind are like research articles. And I'm not sure that that's always the most supportive or accessible for families.
And I think Dina and I were just communicating that this could be a LEND project for the audiology students.
Absolutely.
So thanks, Dina. Appreciate that. I'm not seeing other questions. Other questions or thoughts anyone really wants to share?
All right. Well, I appreciate everyone's attention today. As I said, I know it's summer and in the middle of a busy day. And so I appreciate everybody coming today. I hope everybody was able to take one thing home that fosters their thinking about some of these concerns. And I would love to hear from people about how they would like to, if there is interest in building a sort of a community of practice, to support deaf autistic children, I'd love to hear about that. And I think I don't know, but I think that we're about out of time, so we're gonna have to wrap it up. But the webinar will be available on the JFK website. And I think the presentation will be distributed as well.
And there is interest, by the way, in the community of practice. I'm seeing that posted, so yes.
Okay.
Thank you.
Thanks, everyone.
Thank you.